So what is chiropractic? Chiropractic is based on the premise that good health depends in part upon a normal functioning nervous system. The nervous system controls body functions, much like an electrical system. If it becomes short-circuited, any number of problems can result, including pain, impaired circulation, or even tissue degeneration. One of the primary irritants to the nervous system? Spinal problems. For example, trauma and stress commonly affect the mobility and integrity of spinal joints. The nerves exiting that part of the spine can become inflamed or irritated. Here's where chiropractic adjustments come in. Gentle, precise movements that gradually restore the mobility and integrity of the spinal joints to free up the nervous system. When the irritation is gone, the nervous system can function properly, which is essential for the body's natural defense mechanisms and the overall health of the individual. Structure affects function. It's that simple. Does chiropractic really work? The studies are in. The documentation is available.
Have you read the literature? Because it's there. It's published, it's printed, it's proven. It's no longer a question about it.
Here are just 3 of those studies. The Ontario, Canada Ministry of Health sponsored and financed an independent study to determine how to reduce cost for low back pain. The report found many studies that supported the effectiveness of chiropractic care for a variety of ailments. And it concluded that chiropractic care is safer, less costly, and more effective than medical care. The British Medical Journal published the Mead study on low back pain, which found that chiropractic treatment was significantly more effective than medical care, and that results from chiropractic treatment were long-term. The government of New Zealand commissioned the most comprehensive independent examination of chiropractic ever performed. The report concluded that doctors of chiropractic carry out spinal diagnosis and therapy at a sophisticated and refined level. Spinal manipulation in the hands of a doctor of chiropractic is both safe and effective. No other health professional is as well qualified by his general training to carry out a diagnosis for spinal mechanical dysfunction or to perform spinal manipulation. Are doctors of chiropractic well trained? Most definitely, yes.
Today's chiropractic student, even prior to coming into chiropractic education, has at minimum a year of biology, a year of inorganic chemistry, a year of organic chemistry, and a year of physics. All of these with laboratory assignments, plus additional psychology and humanities. They come to us well qualified to endure a very intense educational program.
The Doctor of Chiropractic degree requires 4 academic years of resident study, more than 4,200 classroom hours. The first 2 years concentrate on the basic sciences.
And is quite demanding. Over a 10-semester period of time, the individual goes through extremely strong basic science. Chiropractic education is built upon the basic sciences. Its principles are in the core sciences of anatomy and physiology and biochemistry and pathology and microbiology.
The last 2 years differ in that medical students move on to drugs and surgery, whereas the chiropractic student begins intensive coursework in manipulation, orthopedics, neurology, spinal analysis, physical therapy, radiology, and nutrition. Doctors of chiropractic become qualified to be primary care providers through their extensive training in the primary care subjects, including laboratory procedures, physical diagnosis, radiology diagnosis, clinical human behavior, pediatrics, geriatrics, toxicology, dermatology, otolaryngology, first aid, and emergency procedures. All of the coursework is taught by highly qualified instructors and professors. The chiropractic science faculty are chosen based on both their formal education and many years of clinical experience. The basic science faculty must have a doctorate or advanced degrees in their discipline.
It's certainly not uncommon for our faculty to also be teaching and hold appointments at other area colleges and universities, especially in the areas of medicine and also in pharmacy.
Toward the end of the 4 academic years of study, the chiropractic student practices in a public teaching clinic under the strict supervision of faculty doctors. There, the advanced student obtains practical experience in examination, diagnosis, treatment, or referral. This culminates the academic learning experience and is the transition from student to doctor. The chiropractic graduate is required to pass rigorous national board examinations. The graduate must then apply and be licensed in the state where he or she will practice. All 50 states recognize, license, and regulate the practice of chiropractic. And most states require continuing education hours each year to maintain licensure. The end result is to keep the doctor aware of advances and research in all fields of healthcare.
The doctor of chiropractic has the skills to serve in that gatekeeping capacity, to assess the overall general health of that patient, and to make the decision, do I treat this patient or should this patient be referred to another healthcare practitioner?
The graduate doctor becomes part of the second largest primary care profession in the United States. Today, there are approximately 50,000 practicing doctors of chiropractic, serving an estimated 20 million Americans. So there you have it. From the scientific basis of chiropractic, through the studies that document its safety and effectiveness, to the extensive professional training that doctors of chiropractic receive. Thank you for your time. We hope these facts will help you when you make decisions that affect the chiropractic profession and the millions of patients they serve.